As mentioned, the record number of COVID cases and hospitalizations continues to rise, and our state healthcare leaders expect that increase to continue. That was just one of the big takeaways from today's Idaho Department of Health and Welfare's weekly COVID media briefing. Our Shira Matsuzawa listened in on that meeting. Shira, walk us through what was discussed. It was most sobering.
That's right. Sobering's a good word for it, Mark. And those numbers came out during today's meeting. In addition to those record number of cases and hospitalizations, Director Dave Jepson said we also continue to set record highs for patients in the ICU and those on the ventilator, even sharing his own personal experience when one of his relatives had to go to the hospital this last week.
My mom had a stroke Thursday morning, just a few hours after crisis standards of care was activated statewide.
Idaho Department of Health and Welfare Director Dave Jepson sharing his own firsthand experience with crisis standards of care during Tuesday's weekly COVID-19 media briefing. Fortunately, his mom is recovering well, but he says when they went to the hospital, x-rays were done in a non-traditional area. The wait was longer, and normally patients like his mom are held overnight. But because of crisis standards of care, she was released the same day.
We are so lucky to have such talented healthcare professionals in Idaho. And those same dedicated healthcare professionals across the state need our help. They need the unvaccinated to please consider choosing to get vaccinated.
As of Tuesday afternoon, crisis standards of care remained in effect in Idaho.
That means that the surge of COVID-19 patients has exceeded the healthcare resources available.
At St. Luke's, Dr. Jim Souza says the patients they're seeing are more sick, they're younger, they're unvaccinated, and sadly, they're dying more frequently.
COVID previously accounted for about 8% of our adult hospitalizations, and today it accounts for 67% with this single diagnosis. That's an unprecedented event in modern medicine.
Dr. Souza says during the winter surge, the ICU mortality rate was at around 28%. Now, it's at 43%. And St. Luke's has had 80 COVID deaths since the beginning of September, adding that's 4 every day the sun comes up. And 35 of them were just in the past week.
Just in the month of September, if you look at the ages of the people we have lost, and you apply to them average lifespans, we have lost more than 1,100 life years. Can you imagine that? And for the people who say we all die sometime, yes, we do. But these people didn't need to die now, and they didn't need to die like this.
He goes on to say for those who go to the ICU and survive, they will be terribly disabled for months. Now, when it comes to monoclonal antibodies, Dr. Hahn revealed the treatment center in northern Idaho treated 90 patients in its first 3 days. Experts say getting the treatment only works if you get COVID or if you're immunocompromised and you're exposed to COVID. Now, it's not a replacement, though, for the vaccine, but because of an increased demand, there will now be a reduction in the number of antibodies allocated to the state, and that means the state could potentially later look at who is eligible and then prioritize, but they haven't done that yet. If you want to find a provider near you, we have a link to how you can do so at KTV.com. Mark?
This situation making news around the country earlier tonight on NBC Nightly News. This was the focus of a Gabe Gutierrez piece. It is just unfathomable.
Yeah.
All right, Shira, thank you.